Let us pray. Father, we thank you for all the folks that work in this great state that protects us. We just thank you for all our public safety and our responders and our firefighters. We just thank you so much for them. We pray today that we would do what's pleasing to you and that we'll keep Georgians safe. In Christ's name, amen.
Hey, thank you very much. Danny was just mentioning that he was an honor graduate in high school. It was honor for him to graduate. I heard that. Before we get started today, I want to recognize Tim Rowe from my office. He's an intern with us this session. Tim, if you'll raise your hand. If we can be of any assistance to you, he and my admin, Vanessa Turner, down in 218 in the Capitol building, we're there to help you any way that we can. Please reach out to these two. And also, Abby Day, the rock star. The rock star. She is our rock. She is our rock. So we're going to take up a very important piece of legislation that's very meaningful to this committee. It's going to be House Bill 451, LC 394113S. This bill passed out of this committee last year and got sent back down. Didn't get called on crossover for whatever reason, and we want to look at this bill again. So, Representative Seabaugh, if you would like to come ahead and present this bill.
Thank you, Mr. Chairman, members of the committee, for the opportunity to present House Bill 451 again. Again, we're working off LC 394113S. I've asked Mr. John Hanson with Alliant Insurance to sit with me today. John has been working with me along with many of the audience members that you see here to find the right solution to curb this growing epidemic, and he'll be able to answer any questions specific to the benefit that you might have. This bill unanimously passed out of this committee last session, but we failed to make it to the floor for a vote before crossover, so I'm back asking you again for your favorable consideration. Just to recap my earlier testimony, what this bill does is it establishes a requirement that all public entities in Georgia offer a supplemental benefit program for first responders diagnosed with PTSD resulting from exposure to line-of-duty traumatic events. The intent of this bill is to create a once-per-lifetime financial safety net for first responders to assist with uninsured costs associated with treatment and recovery. It's designed so that a first responder may access the benefit quickly and confidentially without worrying over a stigma of asking for help. The changes in the substitute bill include the redaction of the contingency statement that stated the requirements of this code section upon a public entity, that is a department, agency, board, bureau, commission, authority, or instrumentality of the state of Georgia, shall be subject to appropriations by the General Assembly. At the time that we add that to the bill, we did not have a fiscal note readily available, and now we do, and that has been forwarded to appropriations, so we felt that's no longer needed. I also included a statement about confidentiality to help ease the stigma of seeking help and ensuring mental health information remains confidential between the patient and their health care provider. That language starts on line 166, letter F, and it reads, information that could reasonably be used to identify individuals making claims or who have made claims or who have received benefits under this code section shall be treated as sensitive mental health information and absent express authorization by the individual shall only be used and shared for administration of benefits, underwriting, and for purposes of aggregation and de-identification, or for purposes of compliance with applicable laws and published privacy notice. Communications in any form between such individuals and the administrator or insurer of the benefits also shall be confidential and privileged pursuant to Code Section 245501. Now, we put that in there because first responders hesitate to seek help. They don't want a mental health record on their health record. And so they're not getting that. So we think this language will help them feel comfortable and reduce the stigma of coming and getting help when they need it. Colleagues, House Bill 451 will save first responders' lives, and it will lend support to all of public safety by giving these professionals the opportunity to seek early diagnosis and treatment of PTSD and continue their work as a first responder. It will keep families together. It will keep moms and dads being moms and dads to their children, and it will make our community safer with these professionals being mentally fit. If passed, House Bill 451 will establish a requirement that all public entities in Georgia offer a benefit program for first responders diagnosed with PTSD resulting from exposure to line-of-duty traumatic events. It creates a once-per-lifetime financial safety net for first responders to assist with uninsured costs associated with treatment and recovery. I'll close my remarks with this and then be happy to take questions. I've survived a 40-year career working as a first responder myself. 10 years as a street medic on an ambulance, 5 years in rural Carroll County, Georgia, with West Georgia Ambulance, and 5 years in the city of Atlanta with Grady EMS. I have witnessed traumatic events that no human should see. Events that if I repeated to you in graphic detail today could cause you to suffer nightmares just by visualizing them in your mind. PTSD is very real and very present in all our first responders that put their physical and mental health on the line for us each day. I'm fortunate so far that I've not suffered long-term disability for my PTSD. But this bill is for those that are not as fortunate. House Bill 451 could be the change agent for a first responder thinking the only way out is suicide. Last year alone, 676 first responders lost their lives to suicide from PTSD. One of those is just too many. What we are considering here today will allow first responders to get the help they need without putting undue financial burden on their families. Mr. Chairman, I want to thank all that have worked for the past 4 years to find a just and affordable solution to this growing problem facing our public safety community. We have many people in the audience today that are ready and willing to give testimony as to the importance of passage of this bill if needed. With that, I will stop for any questions you may have and ask for your favorable consideration.
Thank you, Representative Seabaugh. We've got board starting to light up here with some questions. Let's take a look at number. Representative Evans, are you 28 down there? Yes, sir. Go ahead, please, ma'am.
Thank you, Mr. Chair, and thank you, Representative, for bringing this bill. I just wanted to clarify, you said 676 first responders lost their life by suicide last year in 2023?
That's correct.
And is that in the state of Georgia or nationally?
That's nationally.
Okay, thank you. And do you have any record for Georgia on this? Or?
I don't, but I'll certainly search for it. I do know that the information is available for prior years, maybe 2 or 3 years prior. But to the extent that I can find that, I'll forward that as soon as possible.
Yeah, I think good Georgia information is always good, but national is excellent too. Thank you, though. Yeah.
Thank you. Let's see, number 29 down there, Representative Lott.
Thank you for bringing the legislation. I'm just going to ask a few clarifying questions. I don't think there's really any question in here. I think we all recognize the importance of the work of our first responders and how incredibly traumatic it can be. But to clarify some of the pieces of the legislation, who is paying the premium would be my first question. The insurance is it's a benefit being offered, but how does this work?
As it's configured under this piece of legislation, cities and counties would pay the cost of the premium, would pay the premium for the coverage.
Okay.
And the state DOAS would pay, or the state would pay for the 11,000 or so first responders under DOAS.
For the one-time There was a couple numbers in here. One is a $10,000. Could you just explain that piece to me?
Sure,
Is that
so-
the DOAS piece that you're talking about?
Yeah, so I can explain, roughly speaking, the program or the benefit structure works this way. And think of it on a timeline. So a first responder witnesses or experiences a traumatic event. They're diagnosed following that traumatic event, and it's within 2 years. At that point, they would be eligible for the first benefit, which is, think of it as a $10,000, and this is what it is, a $10,000 lump sum benefit that they can use to help offset the cost of things like deductibles, copay, coinsurance, and especially with mental health, out-of-network costs for therapy. So that's the first part of it. If in 3 months, the first responder can no longer perform his or her duties as a first responder, they would then be eligible for a disability or income replacement benefit for up to 36 months. So that would support them while they're receiving therapy. So if you think on that timeline, the intent of that structure is to encourage that initial diagnosis, right? Because that's the sort of the gatekeeper part of it, which would encourage a first responder to actually seek therapy and a diagnosis for it, right? So it encourages them to enter into that part of their recovery. The first part is, there are a lot of costs associated with the initially in finding therapy through their health insurance. With the Parity Act from last year, there a great amount of support for them to utilize their own health insurance coverages, and more than 96% nationally of first responders have health insurance, so they have access to that. So it's designed in many ways to supplement what they already have. But there are costs associated along that timeline that are essentially uninsured, right? So disability is designed to help them return to work. The lump sum is really designed to cover those initial costs associated with the therapy.
And everybody knows this is probably, at least in this committee, I would think that this is my, one of my favorite things about what we've done in Georgia with the Office of Public Safety Support. And I just want to make sure that, and I always want to make sure that we're utilizing those services as best we can with that office, because that is still growing and there are still places throughout the state that are maybe unaware, or in some cases being a little more stubborn to even encourage the use of a program that we've already committed to as a state. I just wanted to put that out there.
And if you don't mind, let me respond to the reference to OPSS. So we've spoken in detail over the last couple of years to be certain that this program aligns with their work in peer support counseling as well as crisis intervention. So they are very familiar with, and I keep them up to date with how this is moving along. But in many ways, you'll see even in the preliminary language in the bill, there's a reference specifically to the coordination of the work that OPSS is doing. And by the way, it's fantastic work. They need more staffing, but it's fantastic work that they do. So this is designed to complement the work that they're already doing. Let's go.
All right, thank you. Let's see here. Number 22, is that Chairman Petrie?
Yeah.
My
Thank
friend
you,
from the
Chairman.
coast. Go ahead.
And thank you, my friend, for bringing the bill. And as Representative Lott said, just getting caught up on it since it's been a year. Very supportive, but I have a few questions for you. Number one, some notes I'd made. Qualified diagnostician. Does that require a psychiatrist, a medical doctor?
Now, there are 5 occupations that are designated in HB 451
Yeah,
who
tell
are
me.
qualified to diagnose PTSD.
List those for me.
At line
What line?
70, at line 76,
76?
you'll see the definition of qualified diagnostician,
Okay.
nurse practitioner, physician, physician's assistant, psychiatrist, psychologist, all
Gotcha.
of whom have experience in trauma-related diagnoses, right? They're board certified, but these folks would actually be available to specifically diagnose PTSD. And one comment to your question, which is a fantastic one, and in fact underlies a lot of issues in other states who have tried to do something like this, is that you have to find a balance between the diagnostician, available diagnosticians, and then a lot of other therapists or clinical resources. So certain states, for example, Maine, which I work with, together with Minnesota, both have presumption laws that allows family counselors, social workers, drug counselors to diagnose PTSD. So in this bill, there's a lot of balancing between the need to be certain that first responders have access to diagnosticians, but not expanding it so much that the volume is almost impossible to control. So in those states that I mentioned, together with a few other states, there's been an issue with the management of the volume of claims because of this creep or expansion in terms of who can diagnose the coverage.
Right, so I would say that some of these are beyond typically what one would think is diagnosing an illness like
Correct.
this. In Georgia, anyway. I understand some states are much more broad in
Yep.
some of these practitioners. So that answers my question. Second question, can you speak to, so a county, a city, we have private organizations that provide these services as well. Talk to me about cost. So we know it's going to be borne by mostly local government, but talk to me about that in
So-
terms of per capita, et cetera, something along those lines. Help us get an idea of the cost. We understand who's going to be paying for it, but help us to understand the cost.
So in the cities and the counties, where there are approximately 58,000 first responders, their total cost for the program is approximately $155. Per first responder per year.
Thank you.
And to my seatmate, thank you for the question. But it's a once in a lifetime benefit. So once they receive that benefit, the employer would no longer have to pay that for that employee.
Any more questions there, Chairman? Is that everything you need?
No, I'm good.
Who we got number 17 down there? Representative Frazier, I'm sorry.
Thank you, Mr. Chairman.
Sorry about that.
And thank you for bringing this back because it's definitely needed. My question is, on line 53 to 64, you have listed what a first responder is. And so I think about our 911 responders because they have mental PTSD. And is that what A is also including communications? Is that
That's
Is
correct.
that taking care of our 911 callers?
Yes, ma'am. That's correct.
Okay, and who else falls in that category? Basically just the 911 callers, first responders?
Yeah, that's my.
Yes, as a communication officer, the 911 dispatchers.
Okay, thank you.
Mm-hmm.
Representative Cummings, you have a question?
Yes, thank you. First, I wanted to say thank you for bringing this bill, and thank you for including correctional officers, jail officers, and juvenile correctional officers, and probation officers. But my question is, with correctional officers, we're talking about the Department of Corrections, right?
My understanding is that under that code citation, that definition is broad enough to incorporate other, I would say, other types of correctional officers. Between jail, prison, state correctional officers, that sort of.
Okay, because I was wondering if they would also have access to the peer counselors and the critical incident support services that's mentioned on line 26, paragraph 3. If correctional officers within the Department of Corrections would also be
Have access to. Okay,
correct.
so that I don't have an answer for. They would be.
They would be, and it's also noted in here, jail officer, so that would
Correct.
cover the local county jail.
Okay, thank you.
Yeah.
Thank you. All right, number 10 down there.
Thank you,
Then-
Mr. Chairman.
Taylor.
I appreciate this bill. It has a lot of good things to it, but I do have a couple questions. How many carriers have indicated they could support this? Do we have more than one?
We have one,
Okay.
and let me explain why we have one. This is the first type of insurance offering nationally. And there are only so many carriers that would provide, and I'm gonna say specifically to the lump sum benefit, would provide, would file an insurance product in the state of Georgia that would pay only for occupational PTSD. There are other carriers that have somewhat similar programs, but they don't have the means to file, or don't have necessarily have the interest to file. So a lot of the work that I did well in advance of the meeting today was to canvass and speak to a lot of different insurance carriers to determine whether they could possibly accommodate this program. And again, I wouldn't necessarily say that other carriers could or could not. For example, in disability carriers often have what is called a mental nervous rider, which would cover PTSD, right? So the effort here was to find a carrier that could combine the two, because you really didn't want two carriers, one offering one type of coverage, one the other, is to work with and negotiate with a number of carriers that started out at approximately 5, narrowed to 2, and then eventually narrowed to one specific carrier, which is a national carrier, if not the largest group insurance carrier in the United States.
Well, the premium is very reasonable, $12 a month PEPM, which is very reasonable. When you talked about the first-time payment with the $10,000, is there a withhold time for that, or the withhold only applies the 90 days prior to the monthly benefit?
It applies only to the monthly or the disability benefit.
Okay. And if a city or county does not purchase the insurance, are they presumed to be self-insured? They will provide this same benefit in-house?
Yeah, they are not.
They have the right to do that if they want?
Correct.
Okay.
Yep.
Thank you.
Thank you.
Now that we've cleared the board off, we do have some testimony from some individuals that have signed up to speak for the bill. Let's see, the first person we have is Ashley Wilson. We'll give you a few moments here. Brevity will be your friend here today. Thank you. Thank you.
Good afternoon. Thank you so much for taking this bill on for a second year and allowing me the opportunity to speak and give you a face to what House Bill 451 is. Now, I want you to imagine the prettiest Georgia fall. Like, you can wear a sweatshirt all day long and not be sweating by the end of the day. That was what October 20th, 2018 was. It was beautiful. It was a Saturday. It was sunshiny. And we were on patrol. We were day shift, and we had handled some calls for service. And then we get a call from an elderly female who says, "Hey, we've had a lot of burglaries in the area. We want you to go check out this car that's kind of parked near this middle school, kind of where they cut." And, it looks weird. And so, okay, this is what we do. We go and check it out. We've gone to hundreds of thousands of suspicious vehicles. It was as simple as that. "Hey, can you go check out this car for me?" When Antoine Toney pulled up, before he had time to even say hello at the window, he was shot. He was shot 6 times. The perpetrators fled, and in a matter of minutes, my life went from eating lunch with my best friend to he's dead, my life's never the same. I did CPR on him all the way to the hospital. I held his hand in the trauma room while they rendered aid until finally they called it. They said that our friend, who we had just celebrated his 30th birthday 3 days prior, we had just gone out for tacos and beer, was gone. And somehow we have to call his mama in California and tell her. I have to go back and look at a shift of people and say that I tried my hardest, but he didn't make it. And then you know what we had to do? We had to sit on perimeter. We had to stand over evidence. We had 3 days of a manhunt looking for the people that killed him, because as much as we wanted to sit at home and cry and mourn, there was still a job to do. And I did really well. We took him all the way home to California and we buried him. But when things stopped moving, my brain started racing. I had no idea what PTSD was other than having a veteran for a husband, of what I thought PTSD could only come from war. But I had flashbacks. I had nightmares. I went from an Ironman triathlete to someone who struggled to brush their teeth and get off the couch. My life was crumbling around me until somebody said, "Ashley, this isn't you, and you need to get help." I was extremely thankful that my husband and my parents have money, because about $35,000 later, I went to treatment, I went to counseling, and at the end of a several-year process, I came out a better daughter, a better wife, a better friend, but a better police officer. And then as I looked around and I saw the people leaving law enforcement, because there is an evil in this world that exists that I pray you will never see. But we saw it on October 20th, and we needed a resource. So I came here in front of House Bill 451 to tell you that it is time for our first responders to not have to decide whether they have the will to live or they're going to have a place to live. Because that's what it comes to when they decide to not seek treatment, because they have a mortgage to pay, and they are not all as fortunate as I was to be willing and able to spend that type of money. So what you have before you is a resource and a solution for our first responders, and I encourage you to vote for this bill.
We certainly appreciate you coming before this committee and telling your story. Thank you. Thank you for your service. Butch Ayers with the Georgia Chiefs of Police.
All right, and good afternoon. Thank you for the opportunity to address the committee. I stand here before you as the Executive Director of Georgia Association of Chiefs of Police, and I also stand here before you as the Chief of Police for Ashley Wilson and Antoine Tony when he was murdered in 2018. One of the things that, as far as that really kind of got this rolling as well, is, you know, there was no one there to be able to help financially Ashley and other people suffering from PTSD. You know, I, as a police officer, could go to a scene, I could trip over the curb in the driveway at the scene of a burglary. That would be covered 100% by workers' comp. No deductibles, no co-pays, no anything. Yet I could see my partner die before my eyes, and because I didn't have a physical injury to go with it, absolutely no workers' comp. I had insurance, and you've heard Ashley testify. You know, she had insurance, but she had co-pay, she had out-of-pocket expenses, and everything like that. So I think this bill would go a long way to helping with that. And I'll look at it from another way as well. We have a big retention and recruiting challenge in public safety in the state of Georgia. The average firefighter, average police officer goes through 6 months to a year in basic training, and then they go through additional advanced training to serve the citizens of this great state. This bill here would help, just the small cost of this bill would help provide that additional help that these officers and first responders need to help them, you know, get treatment for PTSD, to return to work, and to be effective first responders for their communities. Thank you.
Appreciate you being here with us. Thank you, Butch. John Harrison. Oh, I'm sorry. All right. Let's see. Ronnie Cowart. Ronnie Cowart.
First of all, I'd like to say also thank you, and all for taking this back up. It's very important. I am the chaplain for the Georgia State Firefighter Association. I've been that for over 15 years. I've been with the Cartersville Fire Department. I retired about a year and a half ago, with 36 years of service there. I spent 16 years as the training chief there. And so I had a lot of personal interactions with a lot of people. I'm also a local pastor. And throughout all of the things that we've done over the past 15 years, we've been all over the state doing debriefings from tragic events. We have done a lot of group work that's similar to what the Office of Peer Support does now, which is a great program, and it is very helpful. However, I also know there's still a lot of firefighters out there that have suffered through things, and a lot of them deal with children, and they still have the problem of admitting that they need help. And this type bill will give them the personal help that they need and the ability to do it privately so that they can maintain their great fire service career. So I do want you to know that we have seen and experienced a lot of things on our own, and as was said earlier by our representative, and all that, I'm fortunate that I was not injured that way. However, I have a lot of friends throughout the fire service, 28,000 firefighters that see things every day, and all that they have to carry home with them and put somewhere. So I thank you today for listening to this, and I encourage you to please support this bill with all you have. Thank you.
Thank you. Appreciate you being here with us, and thank you for your service. Gary Clark.
Thank you, Mr. Chairman, committee, for allowing us to come here to just kind of give you a brief of why we're here. So this bill's been going on for several years, and it's seen that y'all are in support of the bill. It passed last year, and for unknown reasons why it didn't get sent through, we're glad that you brought the bill back. This is a well put together bill. We, as the Georgia State Firefighters Association, I'm the president of that association, and we are in total support of the bill. It's something that's been needed for a long, long time. And when you talk about firefighters and each one of us public safety employees, we have our own stories. Ashley has her own stories. I have my own stories. I could sit here and tell you things that would curl you and put you under your chairs, basically. Some of the things that we have seen that we shouldn't have to see or go through and just go over and over and over with things. And unfortunately we've had a lot of public safety employees who've done the unthinkable and took the hard road and committed suicide, and that's what we're trying to prevent. We're trying to get ahead of the ball and get something in place that these individuals can take it and get help, because it's something that's badly needed. We thank you for supporting it. We thank you for hearing our cries as public safety employees. And that's on the law enforcement side. I'm a firefighter for a little over 30 years, been EMS for 30 years, still currently riding an ambulance. I still see it every day. Traumatic events, just here the other day, I went through with one that I shouldn't have to have seen, but I did. But it's a daily thing, and unfortunately, some people break. We have different breaking points, and we never know what that breaking point is going to be. But we thank you for your support on this, and hopefully this bill will get passed and the support that's coming from this committee. Thank y'all.
Thank you for being here, and thank you for your service to our state. Gabriel Carter, ACCG.
Good afternoon, Mr. Chairman and fellow committee members. Thank you for the opportunity to speak here today. Just would first like to start off by thanking Representative Seaball and John and the first responders in this room for bringing a very important conversation to the forefront. At ACCG, we recognize the tremendous benefit that first responders bring to our counties. And frankly, our communities would not be the same without these first responders. So with that being said, the reason I'm coming before you today is to share that while ACCG strongly supports this program, and I just want to make that clear that ACCG strongly supports having a program like this exist for our first responders, we're concerned that this insurance program is being mandated by the state with no state funding available. So that's something that's been a concern for us. So each of the 159 counties in Georgia are different, have different resources and varying resources, you know, big counties, small counties, they just have different resources available to them. And I just wanted to bring up a point based on some of the questions that came up. I think there was a question about 911 officers. Those are often employees of the county. Corrections officers and things like that, disregarding the state, those are often positions being funded by the counties. EMS personnel, law enforcement, some counties have both police departments and sheriff's offices. So these are kind of some of the things that we're considering when it comes to funding for this bill. Obviously, we don't want to put a price tag on any first responder because they deserve to be cared for the role that they play in our communities. But these are some of the things that we are considering when it comes to a bill like this, and hoping that an insurance program like this can exist, but with either opportunity for some state funding or the opportunity for it to be at the discretion of local government appropriations. So with that being said, thank you for your consideration. I hope that this insurance program can continue to move forward with some funding opportunities available, and I look forward to working with Representative Seaball and figuring out how we can address some of the concerns that we have. So I'd be happy to answer any questions if anyone has any.
Representative Lott, you have a question for the...
I do, thank you. I appreciate the way that you've addressed the issue, and appreciate our communities certainly for their part in managing our public safety and first responders. I know that we heard something a few years back, and it was more directly related to using workers' compensation, and it was a little bit less inclusive of the Office of Public Safety Support. And so this is actually, you know, considerably, you spoke at the time as well, and I think we heard you. I think we understand that the communities have an impact with this. I'm actually quite impressed and amazed that it is $155 per person per year. And just from my perspective, I'd like to, again, say I appreciate you doing your job. You're doing it well. We know why you're here, and that's great. You're representing the communities. But the value to this, to the community, is far greater than $155 per person, and I hope that they recognize that. I know that you've probably been asked to come and just make that statement. I am certain that my community does. I'm not very supportive of state-funded mandates on our local communities, but we know here in Georgia that there have been communities that do not support law enforcement like other communities do. And at some point, we have to make this decision so that it is fair for all first responders throughout the Georgia, throughout the state. So again, I guess I didn't really have a question, except that if you could please relay back that we're here taking care of our first responders, and by doing this, I do believe that our communities will receive incredible benefit from the fact that their first responders are healthy. But thank you for your time.
Perfect. Thank you.
Thank you. Any other questions? The chair has a couple of questions for the author of the bill, and I should have got with you before that, and you just tell me how comfortable you are with this, and I want to speak to you, Mr. Coward, also. Not Mr. Coward, I'm sorry. Mr. Hanson, I'm sorry. On 76 through 83, there are quite a few professionals there, and I don't want to take away from anyone who is listed there, but it seems to me that that we're painting that with a very broad brush, if you will. Those who can make that diagnosis, nurse practitioners and just general physicians and physicians' assistants. Would it be beneficial to kind of tighten that up a little bit and have a psychiatrist or psychologist, case specific? I guess that's what I'm asking. I don't know that my physician back home, who's treated me since I was 6 years old, would be, the one that would need to deem a situation that I've had to deal with in a professional setting as one of these cases. So I'm just asking that as a question to you.
So and this is a central question to the operation of the program, right? Because and think of it as I'd mentioned before, it's this sort of balancing of resources where if it's so narrow, first responders would struggle to find a specific type of diagnostician who could provide them a diagnosis. and then move forward into the program. On the other hand, you have this issue that I had mentioned before, some of these states that had broadened it so dramatically that the volume was almost impossible, together with the, and I would say, speculation and fraud and that sort of thing. So a few things to think about in terms of the diagnostician. It can be changed and it can be tightened. The intent of those 5 positions or 5 occupations specifies that they actually are in fact trained to diagnose, to be able to diagnose a trauma-related injury, which includes PTSD. So it's unlike the nurse practitioner that you may see for a physical or something like that. It would be someone who actually has training in that specific area. And it's very likely that, especially if you look at the clinical resources across the state, there are a lot of different occupations within that catch-all of clinical resources. There are nurse practitioners who in fact provide therapy who have been trained in it. And then there are, as you go through that list. So the first answer is it can be tightened if this committee feels that's necessary. 2 is we want to be certain if we make an adjustment like that, we're not constraining access to diagnoses, right? Because if you think of sort of the estimated number of claims annually, what you don't want to do, especially where you have physicians and psychologists who are in private practice, they're not in medical networks. I see work that would follow this, and this is operational work with the program, is to be certain that we're identifying, potentially with OPSS and other organizations, identifying resources regionally through the state that first responders could necessarily sort of, there's one for them, there's another one for them. And if you, to understand, like ACCG and GMA have very large health trusts, so they insure a lot of these first responders. Potentially there's work that can be done to be certain that we've identified those resources throughout the state, right? Through a number of different stakeholders here, which would include OPSS, associations, the first responder associations, professional associations that could assist us in being certain that we're actually creating some type of resource for a first responder who needs that help. We would hope that they would work through their health insurance and that their health insurance could identify a specific person for them to meet with for therapy and receive that diagnosis, which is really how it should work. It's just that if you're out in rural Georgia, that's obviously the question. It's like, how does a rural firefighter in Southwest Georgia receive a diagnosis? And there are a number of different ways to approach it. Teletherapy, as we all know, after the pandemic, has become a very valuable resource for things like diagnoses and for treatment. So there are a number of different tools that are in consideration to build that type of resource to support operationally HB 451.
Okay, I'm assuming that what you're saying is correct here when we have physicians, assistants, and nurse practitioners that are board certified in the medical specialty appropriate for trauma-related mental health diagnoses. So there are those individuals out there that are board certified to do that are in those categories I just mentioned.
So we worked with a third party to help us identify what's that Venn diagram of all the clinical resources in the state of Georgia. And I believe there were 22 different occupations that could potentially diagnose PTSD with the right training. So in discussions with them, we sort of narrowed that down to these 5, which they felt, and this third party is the carrier partner, but they have a very good sense of this in different states where they've had to narrow definitions down in that fashion.
Okay, thank you. Chairman Taylor.
Thank you, Mr. Chairman. On lines 139 through 144, they actually address that at the carrier's request, they can have a reevaluation, and at that time, the carrier can choose someone if there's a doubt, if you want a psychiatrist or whatever.
Stopgap there.
Yes, so there is a place for an evaluation.
Thank you.
Absolutely great.
Okay, that's all of the questions that we have. One more, Chairman, Representative Holcomb, I'm sorry.
Yes, sir. Thank you, Mr. Chairman. I have a few questions. I want to make sure that I understand it. Recognizing that this would give a person 2 years to respond, and that's in line 46, which makes sense. That then relates to lines 158 to 161, and specifically the diagnosis. What I want to ask about is the diagnosis shall include documentation, including the date and nature of the traumatic event. I'm assuming the intent there is for the applicant or the claimant to provide that documentation. And what I want to make sure is that that's achievable, because sometimes what happens is an individual may not recognize the full impact of the traumatic event at that time. And what we wouldn't want is to have, oh, you don't have a document supporting that. So can you address that for me?
So, yes, I can, and that's a great question. That's another operational question. Like, let's make sure it works correctly. So in that instance, and this is similar in other types of insurance, like for example, the firefighter cancer program in Georgia, is that the carrier would work with the diagnostician to gather all the relevant information to support the diagnosis, right? So it's a traumatic event, witnessed, diagnosed within 2 years. So much of that burden is actually on the part of the diagnostician to gather that information and then make a determination as the compensability of the claim. Whereas the claimant themselves may be asked for additional information or confirmation of certain aspects of their diagnosis, but in large part, the gathering of the information is on the shoulders of the carrier, not on the shoulders of the claimant.
Okay. All right. Thanks. A couple more questions, if I can, Mr. Chairman. The debate about whether the state should pay for it or the counties, I think you said that only one carrier provides this. So would it work, or would the plan be envisioned as a single policy or multiple policies by every single entity? And if it is the latter, is that feasible?
So there are two questions. Let me answer the first one and make clear or clarify that because we're working with one carrier doesn't necessarily mean another carrier might enter the market.
I gotcha.
So this is the first part. The second part is a question about the contract structure. So envision this, and this is how the firefighter cancer programs work. You have what is called a master policy. So the counties, all of the participating counties are under the county policy. All of the participating cities or municipalities or towns would be under the GMA policy, right? So ACCG would have a policy here for counties. GMA would have a policy or contract here for cities or towns, and then the state or DOAS would have its own contract specific to state first responders.
Okay, got it. And last question, if I can, Mr. Chairman, is just on the math. Do most folks that work in this space make 60,000 or less?
Yes, I would say that.
Okay, so on line 136, where the cap is 5,000, which is 60,000 a month, what they'd actually get would be 60% of their monthly earnings. So if you made like 45,000, you'd get 2,250 a month.
So the 60% to 5,000 would covers anyone who makes at 5,000.
More than 60. You're capped at 5,000, correct?
Correct.
So everybody that makes less than 60,000, it's 60% of whatever that income is. So if they make 45,000, 30,000, et cetera, they're going to get 60% of that
number on a monthly, and in 12-month increments.
Okay, and capped at 36 months.
Capped at 36 months.
All right.
If you don't mind, just a quick question, just
Yep.
a quick point on the 36 months.
Yep.
Because those kind of policies move around. They could be much longer or much shorter. What underlies a lot of this is really this principle of sort of balancing the cost of the benefit to the state
Yep.
against the value of the benefits to the first responders. So, for example, 36 months, the majority of folks on disability and for PTSD, if they're receiving therapy, will return in within 2 years, right? Pretty standard number. We expand it to 36 months because for those who may not be able to return to work, that provides them an additional year of support so that they can begin to apply to the federal government for SSDI or Social Security disability. So the balance here is not to create a very long benefit if it's unnecessary. It's to shorten it, but being certain we're accommodating people who may not return to work.
I understand. I think it also provides flexibility for those that may have multiple instances but have appropriate treatment after the first time to still potentially restart because it's a lifetime. It doesn't have to be 36 consecutive months. It's
Correct.
a lifetime,
Yep.
right?
Yep.
All right, thanks. And I apologize. I tend to be pretty direct, but for those of you that testified, I'm a veteran. I deployed 3 times. I have my life before I deployed. I have my life afterwards. So I think everybody on this committee gets where you're coming from. We're trying to get it right. Thanks.
Thank you. All right, one more question or comment by Representative Lott, and then we're going to call for the question.
I'm so sorry, this one will be quick. I don't understand the insurance process entirely, so insurance cost containment, what prevents you, or how does that work? What prevents you from raising this $155 per person as soon as we pass this legislation?
So the program itself at the 155 at that rate is, think of it this way. These programs run on what are called rate guarantees. That cost, 155, is a 3-year rate guarantee. So that rate is locked in for the first 3 years of the program. After that, we work with the carrier to negotiate a renewal, right? If the experience is, and we saw this with firefighter cancer, where the experience is